All right, why don't we go ahead and get started? Are we ready up in Carson City?
We are.
Okay, thank you. Let's get started today. Today is a properly noticed agenda for the Silver State Health Insurance Exchange. And we are teleconferencing between the office here in Henderson and Carson City. I think, do we have any announcements at all on anything with the telephone system or something that we need to do with respect to volume or anything like that? Do you think we're all set?
Madam Chair, it appears we are all set to go.
Okay, and then I don't have any announcements. Mr. Gilbert, do you have any announcements?
I do not.
Okay, thank you very much. Then why don't we move on to public comment? Oh, I'm sorry. Yeah, we'll do the roll call then. Make sure we have a quorum.
Thank you, Madam Chair. Ms. Smith Campbell?
Here.
Ms. Atkins?
Here.
Ms. Johnstone?
Here.
Ms. Lewis? Dr. Jameson?
Here.
Ms. Kerr?
Present.
And Dr. Ford? We have a quorum, Madam Chair.
Okay. Thank you, Mr. Gillard. It sounded like we had another voice on the line there. Do we have two people on the line?
I believe only Dr. Jameson is on the line.
Yeah, it sounded like we had it sounded like a
When
male voice.
When I signed in, it said there was I was the second caller.
Dr. Jameson, the exchange is the first caller by default.
Okay.
Okay.
All right. Must have been just some feedback in it then. All right. So we do have a quorum, and so we'll proceed on with the agenda then. Next item is public comment. Do we have any public comment there in Carson City?
No, Madam Chair.
Okay. Do we have public comment here in Henderson? No, we don't. Okay. Thank you. Next item on the agenda is the approval of the minutes for the October 9th. Do we have any additions or amendments to those minutes?
Madam Chair, Lynn Atkins for the record. On agenda item 11, it says Ms. Campbell thanked everyone. I think that needs to be changed to Ms. Atkins.
Okay, any other edits? All right, is there a motion to approve the minutes with the edit from Ms. Atkins?
So moved. Lynn Atkins, so moved.
All right, Ms. Jameson seconding. All those in favor?
Aye.
Aye.
Any opposed? Okay, the motion carries. Thank you. Let's move on to our executive director's report. And Mr. Gilbert, with all the hard work that you've done, you and staff, the board wants to thank you for all that work. We're down now to what, 10 and a half hours?
Right there. Right there.
Okay. Why don't we hear the report from you? I know we're all anxious to hear what you have to say with the onset of open enrollment in 10 and a half hours.
Thank you, Madam Chair, members of the board, guests. Let me start with a caveat, which is that in my travel back and forth between Dallas and Reno over the months, I managed never to get sick, managed never to get a cold, and I was just fine. And I woke up this morning and started having problems. So if I sit here and sniffle and make terrible noises, I apologize. And we'll move away from the table.
Yeah.
General Colin Powell, who is actually one of my heroes, is credited with saying that there are no secrets to success. It's the result of preparation, hard work, and learning from failure. And as the exchange gets ready for a second open enrollment period, I would suggest that General Powell's words are both timely and profound. For months, we've been working in concert with our federal partners, leadership from other state agencies, insurers, the agent and broker communities, our navigator organizations, always with a single goal, and that has been to improve the consumer enrollment experience and make it easy for the citizens of our state to purchase health insurance. There have been literally, and I really mean literally, hundreds of meetings and thousands of hours of work dedicated to identifying and mitigating the operational risks of this particular venture, rigorously testing and retesting technology, always in an effort to create an environment which will support a successful open enrollment this year. We have developed and honed our marketing and outreach efforts. Learning from what we did last year, we've used focus groups to test our concepts and messaging. We have reviewed and changed our website design and flow. We have created specific content for targeted market segments, again, all in an effort to create an environment that will support a successful open enrollment. We've worked with our carrier partners, serving as a technical resource, acting as a liaison to CMS, working in tandem with them to identify and address problems, again, all in an effort to create an environment which will support a successful open enrollment this year. We've reviewed the root causes of payment problems, enrollment issues, informational voids, and other issues that plagued us last year, and we have learned from our failures. The application and enrollment system this year is more robust. Premium billing and collection has been ceded to our carriers, who are experts in this and have been performing these tasks successfully for years. Again, all in an effort to create an environment which will support a successful open enrollment and allow for operational improvement over the course of the coming year. Now, good intentions and hard work weren't enough last year for us to succeed, and frankly, they wouldn't have been enough this year either. If there is a successful open enrollment this year, and I truly believe that there will be, that success will be traceable not only to staff effort, but to the assistance of our federal partners and our sister state agencies that have lent their time, knowledge, and expertise in support of our efforts. That does not mean that there aren't concerns and questions which we have yet to answer. As a supported state-based marketplace, there are a number of important functions involved in the enrollment process that are outside of our control. We can never assure that the federal portal is up and running properly. We don't have the ability to get a call from a consumer, access the system, make immediate corrections, and resolve their problem. We can't impact the timeliness of the electronic data interchange between the federal hub and our carrier partners, or address the quality of those files. However, those are the same issues that 36 other states will be grappling with. And we are hopeful and cautiously optimistic that the significant resources brought to bear by our federal partners increase the potential that we will have a very good open enrollment experience. People ask me all the time, am I confident? Do I feel good about what we're doing? And what I would share with you is, I am confident that we've done our preparation, we've worked hard, and we have assuredly learned from our failures. Saturday's beginning of open enrollment may not be perfect or flawless, but few projects of this magnitude are. Even so, I believe that we've done everything possible and within our power to meet our responsibilities, and I believe that come tomorrow, we will substantially further our mission of assuring access to health insurance to all Nevadans. I do have one last remark which does not appear in my report, but it's something that I shared with staff this morning. You know, as an exchange, as a group, whether we're talking about staff or we're talking about the board, we will be judged based on how well things work out, starting at midnight, and then going on to tomorrow, and then continuing for the next several months. There will be articles and there will be commentary written assessing our success or failure, comparing this year against last year, and portraying us as either getting it right or missing the mark again. I just want everyone to know, members of the board and members of staff, that whether we are ultimately celebrated as successful or derided as a failure, I am very proud of the efforts made by the board and the staff. Everyone has worked incredibly hard, sometimes in the glare of a very unforgiving public spotlight, to vindicate the decision that Nevada create and operate a state-based exchange. If tomorrow goes well, and I believe that it will be, as I've said, because we've learned from our mistakes. We better understand what having a successful exchange requires, and that because we have done what is necessary and possible to realize that vision. Let's see what tomorrow holds. But in the meantime, I would, as your executive director, I would thank you, each and every one of you. And I would share those thanks actually with Romaine and everybody on his staff. You guys have helped us incredibly. Steve Fisher in particular, I can't thank him enough. And I believe that by working together, we've placed ourselves in a position to succeed. And I very much appreciate that. Madam Chairman, that would be the sum and substance of my remarks.
Mr. Gilbert, thank you for those remarks. And on behalf of the board, I think all of us want to thank you for stepping in when you did in the middle of summer, knowing what the task was and the heavy load that you had to manage in order to get us here today. And for that, we're very grateful. Thank you. Do we have any questions on the executive director's report?
Madam Chair, Lynn Atkins for the record. Thank you, Mr. Gilbert. I appreciate all of those comments. Just two questions. One, you said we're going live midnight. Is that right?
That is correct. We will be going live at midnight. I guess it's first thing tomorrow morning. It's not technically today, but it will be at midnight on the 15th of November.
And do we have staff working this weekend, or what's kind of the game plan?
Oh boy, do we have staff working this weekend. We have everybody. It's an all hands on deck thing, Ms. Atkins. We will have people on the ground there in Las Vegas. We will have people on the ground here in the Reno and Carson City areas. And we'll be doing an awful lot of things, including constant testing of the system, including personal appearances at the enrollment stores and enrollment fairs. We will have boots on the ground basically everywhere. We've come up with, I think, a really good plan in terms of how we are going to monitor things, how we're going to know how well we're doing. But we will be working throughout the weekend.
Thank you.
Do we have any other questions for Mr. Gilbert? Okay, thank you. Let's move on to the next item on the agenda, and that is the staff reports to tell us how their particular responsibilities are for the open enrollment today. So who's going to do the open enrollment plan for 2015? Is that Mr. Haycock?
Yes, Madam Chair, I will. So
All
for the
right.
record, Damon Haycock, the IT officer for the exchange. This report is to provide those critical updates to the board and to the public on open enrollment activities for plan year 2015. We'll be going over the supported state-based marketplace transition, which is in attachment A. We will also be discussing the plan year 2015 carrier onboarding. That will be given by our quality assurance officer, Laura Rich. We will also discuss marketing and outreach updates provided by our communications officer, Tyler Klimas, and KPS3. And finally, the enrollment assistance and grantee report provided by our Chief Operating Officer, Shauna DeRoos. So with that, I'm going to go ahead and move to my section, which is Attachment A, the supported state-based marketplace transition. And right at the top of this report on page 1, you'll see an activity milestone table that shows where we are at today. And some of the most telling signs are that we are complete with the bulk of our activities, and we are right on schedule for open enrollment. All the qualified health plans have been certified by the Division of Insurance. The rates were posted for this next year. We have relaunched NevadaHealthLink.com on November 3rd. We will also the Access Nevada was relaunched this past Monday on November 10th. And of course, as our executive director mentioned, we will go live this evening into the wee hours of the morning on November 15th to begin open enrollment. A brief overview, and again, some of the staff from the exchange will go into more details and further attachments. Carrier onboarding, that carriers have successfully completed all of their EDI and boundary testing. That began October 7th for that end-to-end testing critical component. And that staff with the exchange has participated hand-in-hand, one-on-one with our carriers to ensure that we provided the best customer service to our carriers and our teammates to ensure a successful launch. As far as plan certification, the Division of Insurance has transferred all QHP data to the federal hub, and carriers and the Division of Insurance staff have been actively reviewing data in those test environments to identify compliance and display issues. For brokers and agents, the brokers and agents are required, of course, to take that federal training to utilize healthcare.gov during the next open enrollment. And to date, 503 of them have completed all requirements. Going on to page 2, the exchange enrollment facilitators, they too are also required to participate and complete in federal training for 2015. As of November 7th, you'll see that we have numbers of 38 navigators and assisters and 57 certified application counselors that have completed this training. As of the end of the day yesterday, those numbers are 43 navigators and assisters and 66 certified application counselors. An additional 67 are in training currently, and we hope to have them participating in this process for next year. With Medicaid and Nevada Checkup, Welfare, the Division of Welfare and Supportive Services, they have successfully relaunched Access Nevada, the platform for Nevadans to enroll in Medicaid and Nevada Checkup. They have developed connectivity between Nevada HealthLink and Access in Nevada through a very handy, I don't know a better adjective for it, but pre-screener tool, a very successful, simple, and easy to use to help Nevadans navigate, and those that assist Nevadans in navigating where they should go to enroll in the appropriate health insurance process and program. After that brief set of questions, they will be provided a pre-eligibility result that directs them to either healthcare.gov for a qualified health plan, or of course Access Nevada for Medicaid and Nevada Checkup. And we find that this will be very critical in assisting Nevadans navigate through this new system. And finally, the NevadaHealthLink.com was relaunched on November 3rd, a new look and feel to the old site, with information about enrollment, in-person assistance, and of course managing your current 2014 health plans. A robust assister lookup tool was added, as well as a calendar for upcoming events. And as well as Access Nevada, connectivity to healthcare.gov will be finalized this evening to ensure we have a successful kickoff. And with that, I will answer any questions before I pass it on to Ms. Rich.
Okay, thank you, Mr. Haycock. Do we have any questions?
Madam Chair, Lynn Atkins for the record. Damon, just one question. You said that there's 67 people in training, and I think you said they'll be ready next year. Do you mean January? Or I just wanted to get a little more detail on those 67 that are currently in training.
So, Ms. Atkins, those 67 that are currently in training are those that we have sent to CMS their IDs so that they can participate. And we are just awaiting them to complete that training and send us their certificates so that way we can put them into our lookup tool and ensure they're available for Nevadans to assist. So that could be as early as tomorrow and as late as it takes them to get through that training process. The bulk of them are certified application counselors, and so it is on their time to determine when they are prepared and ready to help Nevadans. But we are here to help them get through this process.
Thank you.
Mr. Haycock, I have a question for you, if I might. Compared to last year, where are we as compared to the number of navigators that we had last year and certified application counselors? Do you know what those numbers are?
So,
Or just a ballpark on it?
Yeah, Madam Chair, I don't have the exact numbers. I know we had more than 150-ish total EEFs at the last time that I looked for 2014. And if you do some quick math, we're about there again, 167. I think we had more certified application counselors at this point in the game last year. Well, I won't even say this point in the game, because last year we were still getting folks through training, through our 4-hour block of training, through the first month of open enrollment. But as compared to where we were for 2014 now versus where we will be for 2015. As far as navigators and assisters go, we feel we are very comparable, although we've reduced those navigator entities down to those 3 that the board approved earlier in the spring. So we feel we have a very comparable amount of people available to help Nevadans.
And also, how long does that federal training take for them? Is it comparable to what we did with them last year?
The training itself is about 20 hours. Certified application counselors have to attend less. We were asked in the past from our federal partners if we were going to do any retraining of our current navigator staff, and so the decision by staff was to utilize healthcare.gov and CMS's training program. That way folks would get a refresher on all of the different activities of an exchange, Medicaid, qualified health plans, APTC, all of those factors, as well as understand the navigation through the system. So with those 20 hours, we believe that has exceeded the 4 hours that we were providing them last year.
Thank you. Are there any other questions before we move on to Ms. Rich? Okay, thank you. Ms. Rich, I think your attachment B, the carrier onboarding.
Thank you, Madam Chair. For the record, Laura Rich, Quality Assurance Officer for the Exchange. Like Mr. Haycock mentioned, the Exchange has been working very closely with the carriers the last several months. On October 10th, the Division of Insurance certified a total of 154 Exchange plans, 108 of them being medical plans, and 46 being standalone dental plans. We also had a new carrier come onto the Exchange, and as a result, we're seeing a variety of new products, including PPO plans, which were not offered on the Exchange last year in 2014. So I'm pleased to report that the onboarding process went rather smoothly this time. Given the time and level of technical expertise that was required from the carriers, the Exchange staff, and various other entities involved, it was rather smooth, a smooth process with not a lot of hiccups. The 5 medical carriers and 10 dental carriers submitted their registrations to CMS in September, and in early October, CMS opened their testing environment so that the carriers could begin testing. So although the Exchange had very limited access to this environment, staff was able to participate in the testing process by scheduling one-on-one sessions with each of the carriers. And as a result, the carriers were also able to get a sneak peek at the Nevada HealthLink pre-screener, and the carriers were also able to demonstrate to the Exchange staff how enrollment files were received and how that information was then entered into their system, and a consumer was then effectively enrolled and effectuated through healthcare.gov. So essentially with some coordination and timing, both sides were able to see how an application was submitted from start to finish. And one carrier also provided the Exchange with a demonstration of the direct enrollment process. So as of today, 210 cases have been performed, and there are currently 18 open defects that have been reported to CMS. Thankfully, none of these defects have been considered critical or showstoppers. At this point, most of the carriers have verbally stated to the Exchange that they have a high level of confidence that as go live approaches, they feel fairly confident that it should go off without a hitch. CMS has halted their testing for an undisclosed number of days, but at some point, carriers will resume with this testing in the shop and direct enrollment testing environment. So I also wanted to touch on direct enrollment and carrier outreach. And as we've mentioned before, Nevada's in a unique situation. Consumers will need to take a more proactive approach and in order to enroll into a 2015 plan. They're not going to be automatically enrolled. So we expect that the direct enrollment option, which all 5 carriers have chose to implement, will help the carriers retain some of their current members. Direct enrollment also allows the carriers to be proactive in their outreach. So they're going to have the capability of calling a customer and enrolling them into one of their plans over the telephone. This not only lessens the burden on the consumer, but also minimizes any potential delays in the carrier receiving enrollment information from CMS. So the carriers have reported to the exchange that they're going to be utilizing the direct enrollment tool to maximize their retention rates, but additionally, they're sending out various notices and direct marketing material. Other carriers have stated that they're working with either brokers in the community or on-staff brokers that they've hired to participate and provide outreach within their organization to new and existing members. So I just want to emphasize that the general consensus for tomorrow among the carriers is that while there's certainly no expectations that everything is going to run perfectly smoothly, the known defects have been mitigated, and their hope is that it will be successful tomorrow. So with that, I'll take any questions, or we can move on to Mr. Klimas's report.
Okay, let's open it up for questions. Or do any of the board members have questions about carrier onboarding? There are none. I would like to ask about the new carrier that is joined. I think that is Assurant Health. Is that correct? As a medical carrier?
Yes, that is correct.
Okay, and could you tell me where their product is going to be offered? Are they just in one part of the state or through the whole state, or where are they going to offer coverage?
I believe, I'd have to verify that, but I believe, Mr. Haycock, do you know?
I believe, Madam Chair, they are in the north and the south. I can't verify if they are in Service Area 4, so we can find that out and get that to you. But I'm pretty confident that it's in Service Areas 1, 2, and 3.
Okay, so they're going to cover the rurals as well?
They may not. That's the only part I'm not 100% sure on. But for Washoe County, for Carson Douglas, Story, Lyon counties, as well as Clark and Nye counties, I believe they are represented in all of those.
Okay, and then can I just ask which of the medical carriers are in the rural areas?
So again, I'll have to confirm that, but I believe the co-op is definitely in the rurals. I'd have to confirm. I don't know if Anthem or Prominence is.
Prominence was last year.
Yeah, I'd have to confirm.
Mr.
I'll get back to you on that, Madam Chair.
Is Commissioner Kipper here, or somebody from DOI that might know?
He is not. He was traveling, so he was unable to be here today.
Okay.
Madam Chair,
right.
I think Mr. Haycock is going to contact the DOI right now for you.
Okay, thank you. Just I'm curious how good our coverage is out in that area. And that was a very comprehensive report, Ms. Rich. Thank you.
Thank you.
So we're heading on to Mr. Klimas.
Yes, thank you. So I'll ask Katie to come up, Madam Chair. Thank you. Just before Katie gets started, this is going to be a brief overview of certainly the website launch, what we've done. We're not going to play the TV spots. I know that you all had the opportunity to see those, and they've been live for a week now. I would just like to say before Katie gets started that you at least commend Katie and her team, KPS3. This has been a pretty big undertaking, simply to build off of last year. To, I think when you go into year two of any kind of marketing campaign, with a new brand, it's so important to really do the research, which we've done, but to actually make the positive steps and that result from that research. I think we've done that, and it's been an exciting process at times, and the feedback that we've gotten thus far has been great. I think we've hit our targets, but we did the due diligence beforehand to identify those targets, and I think that's what's important here, certainly with the help from KPS3. And beyond marketing, the outreach, I can't tell you, I know you'll see them, the enrollment stores, the one in Vegas and the one in Reno. They're unbelievable. I mean, they're beautiful, and the way they're set up is just so consumer friendly. It's so inviting. You really have to see it kind of to believe it, but even with a lot of the press and the reporters we've been talking to, just telling them about these, and they all kind of stop and they say, really, 7 days a week? Because you think about it, I mean, we're talking hours, 10 a.m. to 7 p.m., 10 a.m. to 9 p.m., and then 9 a.m. to 9. I mean, those are long hours. A lot goes into that administratively, and support from our partners. We could not do these without our agent and broker community. Couldn't do these without our Navigate organizations and our sisters, and then certainly the Medicaid staff that'll be there. So anyway, that'll be it. But I just, it's a big deal, and people are really reacting positively to it, and I can't wait to kick these off tomorrow. So anyway, with that.
Thank you
Katie.
very much. And Katie Coleman with KBS3 for the record. And I have Rob Gadke joining me from Carson City to help answer any questions you may have. So as Tyler mentioned, we're going to keep this brief, but we're glad to address anything that you see in this presentation. So I'm going to jump to page 3. I'm going to walk through the media campaign really quickly. We have launched the digital campaign starting November 5th, the outdoor campaign starting November 5th. TV started on November 10th, so hopefully you've seen some of those out there already. Print started November 10th. Again, that's really a tool we use to reach our rural areas in addition to our Latino audiences. And then radio starts this week, and we already had quite a bit of pieces out there promoting the Rio event and the stores already on our partner channels, all of the media outlets that we've already partnered with. We got a lot of added value to get the message out about Saturday, big day. So as far as media goes, that's a very brief overview of where we are and when we started. To hit upon some phasing just really quick about the media, as we move into the new year, we're going to be changing out some of our calls to action to ensure that we have a real urgency message coming on board at the first of the year to identify you still have time. And then again, another message switch out at February 1st. Say, this is it, got to do it, and really hammer that home. So on the next page, here's just a sampling of the pieces that are out there, print ads, digital ads, and then a sample of what's going out on there on the buses. And then, of course, we have the television spots running. And I'm going to move on to page 5 to give you an update about the outreach and enrollment activities. So I'm going to address some of our outreach activities that have already happened outside of the stores and then get into the stores. We've been at 27 outreach events prior to open enrollment. So again, we really wanted to get out there and let folks know what's going on, when they need to do things. And by the way, we're going to have these static locations that you can get into and get some help, in addition to pointing them to our broker and agent partners and navigator entities. 40 distribution locations. These are partners throughout the communities that have asked for materials to put in their offices and community centers and what have you. Some metrics behind that. This is just before open enrollment. 106,000 touch points. That's measured by how many people we're reaching with the brand. 4,200 one-on-one conversations before open enrollment. So those are the activities that have happened outside of the stores. The stores obviously haven't opened until tomorrow. The Boulevard Mall, we're at the Boulevard Mall, 10 a.m. to 9 p.m. On Sundays, we're there from noon to 7. And we have 35 stations there. And then in Reno, we're located on the corner of McCarran and Longley from 10 a.m. to 7 p.m., 7 days a week. We are going to have extended hours on the 15th day of each month to accommodate those folks who want to get in from 9 a.m. to 9 p.m. in both stores. Again, 7 days a week. And to Tyler's point, the big push behind this, the reason this happens is because of our brokers and our sisters and our navigators. My team set them up and they look great, and we're managing these things, but really they're the power and the engine that's going to get this thing going. So I thank everybody for that. And then in addition to the stores opening tomorrow, there is the Get Healthy, Get Covered health fair event at the Rio. That goes from 10 to 6. The Ramirez Group is putting that on, and we are helping support that in addition to our brokers and assisters coming together. There's about 300 stations there for people to sit down and get assistance. There's another section to the event, health fair style thing with 80 vendors as well. So it's a really nice way for people to go out, get some more information from some of our community partners, but also get the enrollment process going. So with regard to tomorrow, I invite everyone to come into the stores, give you a tour. and love to see you there tomorrow. So the next page, this is just a snapshot. This is a couple of the storefronts literally outside of the doors of our 2 stores. Reno's on the left, and the Boulevard is on the right. And here's a shot of the front lobby area. So there's a lot more to it than those couple photos. Again, come and check it out. And then I'm going to move on to the website update. So as Damon mentioned, the new NevadaHealthLink.com and its sister site, Enlace de Seguro Medico Nevada.com. They launched on Sunday evening, November 2nd, actually. And we're relaunching tomorrow night. We're getting everything prepped for that 12 o'clock midnight time. And of course, we're aligning that with the healthcare.gov launch. That also launches the pre-screener tool that everybody can go in and start to.
Tonight.
When did I say?
Tomorrow.
Oh, it's tonight. It's tonight. It's happening tonight. It's on my. I promise you. My apologies. Thank you, Shauna.
Don't miss it.
I won't miss it. Exactly.
We don't want you to
It's
miss
like
it.
showing up late to your wedding. No, it's not going to happen. Okay. Alrighty. So some metrics, and these are the metrics that were submitted when this report was submitted. I wanted to give you some updated metrics as of right now. 43,542 visits. So that's a lot more than the 26,220 visits that we had just a couple days ago. So we're ready for people to hit that site and really dig in there and certainly launch that pre-screener tool to start their applications. And then I wanted to follow up. I know last time when we presented at a meeting, we talked about search terms, and we did go back into Google Analytics and reviewed where we're ranking when you search for Nevada Health Link. And we are number 1 on the search listing for key terms. This is just a sampling of those key terms, but we are pretty much number 1 across the board. So I really wanted to assure everyone that is being monitored, and we're ensuring that our ranking in the search world is where it needs to be. And then I've included a couple pieces of information about search traffic sources, where people are coming from when they are actually searching for us. And then I'm going to the last page regarding the re-enrollment initiative. In addition to a lot of the great stuff that's going on with carriers, we have also launched a re-enrollment initiative, a campaign essentially. We have sent an email and a letter to all current customers. We sent that on October 2nd, actually, getting them prepped for the idea that they have to do this. We had an incredible open rate, 33%, which is massively great. So we were very happy with that. We sent a second email and a letter on November 4th and November 7th, respectively. Again, another high open rate, 17%. Dropped a little bit, but it was the second one they got. So we have to assume that there was a little bit of dip for those who said, yeah, I got it. I know what I need to do. But we're going to take it a step further. We're going to ensure that we track those emails to know who's opened them, who hasn't, and then continue to outreach to them. We're actually going to follow up with a messaging service, a little phone call, just a nice reminder saying, and this would go out to those who haven't opened any of our emails, saying, just a friendly reminder, you need to do this. So kind of couple touch points there. In addition, this is really neat aspect of this campaign. In the email, we've applied a little bit of a tracking code, and what that does is when someone opens the email, it designates or tells us that they've opened it, and they're served a little banner ad when they go to another website. So we retarget them with the same, we got to hit you with this message because we don't want you to forget. So again, that's that retargeting. We know you opened it. We're going to serve you with the message yet again in a space that maybe you weren't expecting it. And we think that that's going to have a real impact on people being able to remember to do that. Key messages, they have been distributed to brokers, navigators, carriers. All of our outreach teams know how to talk about re-enrollment as well. So that was really important to our initiative here. And then we will be sending more emails and more letters first week of December, before that December 15th deadline, to make sure they really know they got to do it. And then again, another one, January, February timeframe, to let them know about the end of open enrollment.
Madam Chair, if I could say something else about the re-enrollment. Re-enrollment in general for us this year, I mean, it is one of the biggest mountains that we have. And because it is unique to Nevada and only one or two other states, because of our transition, it truly is an initiative. And, some challenges along the way. CMS sends out their press releases to their states, and they go out to partners, across the U.S. And even Lynn, I think you had sent me some of the correspondence as well. And the message is different. If you don't take any action as an FFM state, you're automatically renewed into your plan with a subsidy, and that's just not the case. So, beyond the education portion of this campaign is just critical. And I think that's why you see so many touch points and why we're hammering on this point. But just one thing, and it happened this morning, Madam Chair and I happened to be on the same flight this morning, and you had a USA Today. And it had each state, it only had about 2 sentences from each state for open enrollment. We did not have a conversation with USA Today in the media. We did not have a one-on-one sit-down with them. But in there was Nevadans must re-enroll. And not only must they re-enroll because of the system changes, they must do it by December 15th for January 1st coverage. And I think that just reinforces what we've been doing, because that is very, very unique to Nevada. And obviously that message is getting out there, and it's getting out there through all of the counter messaging that's coming. So I just wanted to bring that up, and I thought that was pretty neat this morning. So.
Madam Chair, yes. I wanted to share that, just moving to this location and some of the activities. I'm sure those of you who live down here have heard of the glittering lights in Las Vegas. So it's out at the raceway, the speedway, there is this activity that you can do, and they've put up amazing lights that you can actually drive around the raceway and drive through tunnels of lights. And the area businesses have sponsored this. And we were able to go out there for the opening night this week, staff and our families. And it was really, really fun to be able to go through and see the Nevada Health Link sign in our colors, lit up against the night sky with and we were actually commenting, we didn't know what was prettier, the view of the valley and the lights or the colored lights. But what amazed me the most was we were in kind of a tram, like you're at like at Disneyland, and all these people on the tram said, "Oh, look, Nevada Health Link." and it was they didn't do that for a lot of the others. It was pretty amazing, and we felt pretty good about it, I think, and it was beautiful, and it was just another way to get the word out there and have our name out there. And so if you do go do that, be prepared to see Nevada Health Link out there.
Great. That's cool. Is Rob going to make a presentation, or is there just to support you?
Just to,
I'm just here to smile.
It's tonight
just in
instead of
case
tomorrow.
I can't read a calendar. Rob's right there. Yep.
All right, do we have any questions from board members? Yes, Dr. Jameson.
Beautiful presentation based on amazing work. Great outreach there. And I guess what my question is, and I think I just missed this somewhere along the way. Do you collaborate with the large corporations in our city? Reach out to Costco businesses to have them connect with the employees that might want to use us that are employee don't get benefits? Do you reach out to MGM? Do you reach out to, I just missed if that's in part of your outreach, do you know what I'm saying? Costco, some organizations, I don't know, is it Taco Bell in the media that their employees don't get insurance or whatever? Do you include big businesses that have huge number of employees that may have no benefits? As part of your, as she's saying, what do you call them, contact, connect?
Like the part-time employees. You're talking about like the part-time employees.
Yeah.
Okay.
What did you call that?
Touch point.
Touch points. Yeah. Oh, that's a good
After 2 years, I got touch points.
Room full of marketers, all right.
And the reason I would you?
So I can comment on that. So the navigator organizations that we have across the state, several of the larger corporations, they have partnered up with them. I know that CARE and Ramirez Group both have reached out to several of the casinos in town they've held enrollment fairs with them. They did that last open enrollment. It was difficult at times, but they're planning on those events again this year, and we hope to be able to get more people enrolled. The casinos especially were very amenable to that and helped out and provided space and provided all sorts of information to their employees to allow us to come in and have some events at their locations.
So I just wondered if that's our target, because I'm really worried about our competition. It might not be a competition, but you know, our sustainability is based on that small little bit we get off of the number of qualified health plans we enroll. And I know now, since we've established ourselves, there are so many other entities in the marketplace competing for those, and they do outreach to other people. I can't, you know what I'm talking about. So like groups like the custom benefit consultants, they are just blasting everybody and basically taking their product, which shows how to sign up for your health plan and do everything our plan does. And they are going to these places such as Costco or MGM, and they are getting them to work with them and giving them a royalty and get everyone they can to sign up for a qualified health plan of a product that's basically similar to ours sold on their site. So I'm worried if this picks up, because I don't know if you guys have visited their sites, but they are they're amazing. And so I'm just trying. These guys could literally they're with the chamber and they're with this and they're with that, and they can get a huge part of that market we're competing with. I just want to know if we're making touch points to compete with them.
Well, just speaking, I think that's a great idea, and especially, you know, once we launch tomorrow, I mean, that's getting into those businesses. That's shaking some hands and sitting down and talking, that kind of outreach, and that certainly would lie with the staff here. And I just think that's a great idea, and I think we'll absolutely pursue that, because you're absolutely right.
Well, and this is Leslie Johnston. I would assume that some of these health fair type events that you've been at already would have reached some of those groups.
Yeah, we do connect with businesses quite often. Yep.
Well, the other thing, Dr. Jameson, the one thing that we can offer in competition to those groups that you're talking about is a subsidy. They can't give the subsidy to those enrollees. Only we can.
That's right.
So, I mean, that's
an excellent point.
That's you know, and I think that's, if we really are countering them, particularly in this market, then we need to beef up the subsidy portion so that people understand.
Yes.
That's where we beat the competition.
Yes, and they do have on their sites how they can see what their premium tax rebate will be, and what, if they qualify for that, and what it would be, and they can then contact a insurance person and have that person do all that for them.
Go through us,
But it would then have to come through us for that,
we still get
for that rebate. You have to go through us.
Right. But they've got that info on there. I was really blown away.
So I think being a state-supported, and you guys can correct me if I'm wrong, but being a state-supported exchange, it's just another mechanism that wasn't available before, that they can do the direct enrollment, and it's still an exchange product.
Do we have any other questions? I have a couple. Who came up with the concept of the stores? I think it's marvelous. And who's going to be staffing those 35 seats? Is it self-serve, or how does that work?
That would be chaos.
No, certainly not. KPS3 will provide and Katie, jump in anytime, Madam Chair. KPS3 will provide the administrative staff. I believe there's 10 in each store? 20,
we have 25 down here and another 10 up north.
So 10 up north and 25 in Las Vegas. But the 35 spots is which we have in Vegas, and that's spots. When I say spots, those are computers, connections that a consumer can come in and sit down and work with a professional. So 35 spots, and that'll be a mixture of agents and brokers, assisters, and then we have a few spots for Medicaid personnel. So we've done training at the stores the last few weeks where, we send out emails to our listservs, to the agents and brokers and assisters. They don't just get to, they don't just come in and sit down. We've actually hosted training, how it's going to work, how a Nevadan comes into the store, how we use the pre-screener, how they're then put with a professional. And they're split. It's very much a partnership. And, Sean and I were able to talk with each of the groups. We participated in each training. And, it was very much something where this has to be a group effort. Everybody has to work together or it doesn't get done. Open enrollment doesn't happen if you don't work together. And everybody was on board. By the end of the trainings, people were shaking their heads. I think they're involved. And I think it's going to go, they're hopeful. Certainly. And so are we.
We can't take credit for the enrollment store, actually. This was done by Connecticut, last open enrollment. And we actually spoke with the folks in Connecticut and got a lot of tips and tricks and what not to do and what we should be doing. And and it worked really well for them. So
I tell you, you could see the year of maturity of what's happening from last year to this year. And if there aren't any other comments, I do want to compliment your principal, Stephanie Cruz. I understand she's a finalist, a national finalist for Entrepreneur of the Year, and I'll be going back to New York to see if she is selected. And you don't get there without a great staff. So compliments to all of you on that.
thank you.
All right, our next report.
Okay.
Ms. DeRoos.
For the record, Shauna DeRoos, it kind of goes along with what we've been talking about a little bit already. The stores, the training, the assisters, the brokers, and everything we've gone through over the last couple of months. So we currently have about 175 EEFs, and we have 116 of those who have completed the CMS required training. So these are people who will be able to, starting tomorrow morning, will be able to enroll people, put in the number that they've been assigned, and the system, the federal healthcare.gov system, will accept that number and say this is valid and be able to go forth and enroll someone. We still have about 20 EEFs that have completed the training, but we're waiting on the DOI, Division of Insurance background checks, to get that final go ahead and get their certificate so that they can also perform these duties. So our numbers will grow, and as more people complete the training and we get our DOI certifications, again, hopefully we'll get up to the full 175. We have, in addition to that, we have I think quite a large group of brokers who have gone through that CMS required training. As of 11/3, so we're a couple of weeks into this, and the numbers only get updated once a month from the feds. We had 503 Nevada resident agents, producers, brokers, and then an untold number of non-resident agents that had gone through the training and were ready to start this weekend as well. And then, as Tyler just talked about, the trainings that we had at the stores over the last couple of weeks. Tyler had 4 trainings in the north. I had 4 trainings in the south. We had about 200 brokers and EEFs that came through and said, we want to take up those 35 spots in the south and the 10 in the north. We had them sign up for shifts and go through the training. And I think that we touched on all the things we've talked about today. We've touched on the changes in the system. I mean, little things like this year you have to have an email address to sign up. It's just a different process. Things like how to go about the transition in the stores between Medicaid versus an EF, or if an EF starts with somebody and they need to pass them off to a broker, when's the right time to do those things? It was also exciting to see that not only were there quite a few brokers that came back and said, we're willing to give this another try, there was a lot of new brokers. I had one at my training that actually hadn't even received his NPN yet from the DOI. He was still waiting on it, but he didn't want to miss out on the opportunity, and so he came through the training so that as soon as he got his NPN, he'd be ready to go. So that was just kind of exciting, I thought. Really talked a lot about re-enrollment. And that for us, technically, it's not even re-enrollment, it's just enrollment. And that message. And getting that word out to the broker community that, again, the system's not going to know who you are. This is really brand new, starting over, and to be prepared for that. And we did provide our federal partners, and maybe you guys talked about it while I was out of the room, the list of all of our enrollees and the plans that they were in and things. So if somebody does have a problem where they say, I want to be on the same plan I was on this year, I just don't remember the name of it, we can call the federal call center. They will be able to provide that information to our clients. So that's a big help too. So a lot of those types of things were talked about during that training. Another thing that's happening is the difference this year in the online lookup tool. If you recall last year, you could go out to Nevada Health Link and look and find somebody locally to help you. You could put in your address or a zip code and find those people. So we currently have 365 published, we call them published, contact points. And now that might be an organization, it might be a broker navigator organization and a sister. There's 365 there. We don't publish them until we have verified their training through the DOI, their licensure or certification, and the fact that they have completed the CMS training. So we won't actually put them out there for the public to view them until we know that they are actually ready to help somebody. We currently have about 83 pending where people have filled out the form to be published, and we're just waiting to get the information that they are ready to be out there for the public. So the in-person assistance listing out there this year, another difference is that it gives hours and days of the week that people work. We didn't do that last year. So it's just a little bit more specific for people, so they know right offhand if somebody is working later or not, in the middle of the week. So that's something new that we've done. The grantee calls, I think that the section of the report, talking about the outreach opportunities. If you've been out to our site, you've seen the KPS 3 calendar. There's also links there to the 3 Navigator organizations, so you can go out to their calendar. Some of those are very, very full. We're putting some of the big events like the Rio event and things on the KPS 3 calendar as well. But man, to try to put all of those on one calendar would have just been overwhelming for somebody to read. So it's nice to have the 3 separate calendars there. I know from speaking with the carriers even, they go check those to see if they need to contact some of our grantees and say, we want to be a part of this event. I know a lot of them are going to be at the Rio tomorrow. Not only that, but our carriers have also provided very generous marketing materials for the North Store and the South Store, and those are still coming in. So we're working as partners in that capacity as well. We had to change our reporting requirements for our grantee organizations this year a little bit, not wanting to collect that PII, not wanting to have to keep that information in our systems. So as we go forward and we start reporting back to you how many people are enrolled, now our federal partners have said that they can't tell us, Shauna Durst has an EEF. If I was enrolling people, they can't tell me how many I've enrolled. So it's up to our assisters to keep track of the people they enroll. We'll be providing that to the board in an aggregated number. Again, all the Navigator organizations will be participating and staffing at the enrollment stores 7 days a week. And again, at least some staff from all of them have completed all the training and provided the information so that they're ready to go. I will say that tomorrow at the Rio, not only are we ready to go for open enrollment, but staff here, we will be at the events. There will be those people that walk in and say, can you help me with this older situation? And we will be there and we will be ready to help them no matter what their situation is, whether it's going forward or in the past.
All right, Madam Chair, one follow-up question. That was one of my questions. So thank you for that. And maybe I missed this. When will we be getting kind of numbers updates from the feds, just in general?
Numbers updates of
enrollment.
I can. Well, so I participate on, they're called communication cluster calls. So it's basically all the exchanges, their communication departments. Of course, that's what everybody wants, and it's very, very unclear. Last year, for most of the states or for all of the states that didn't have their own exchange, they didn't receive their numbers till after open enrollment. Now, what we can do is, and what we will do is work with the carriers. So that's our avenue into how many people are enrolling, because they have to go through them. That doesn't mean on Monday we get numbers on, how Saturday and Sunday went. We also have the enrollment stores, which when somebody exits the store, there is a little card, not with information, but this person signed up for a qualified health plan. This person enrolled in Medicaid. So we'll have some sort of a look into how things are going, but certainly, again, we're going to have to go through the carriers and rely on them for this information. The feds might have a new system that they unroll, but they've not alluded to it as of yet. So we're going to do whatever we can because everybody's going to be interested.
When you're ready.
Oh, okay, thank you. Tyler, when you say you're working with the carriers on that, are they going to give you those numbers on a weekly basis? I know a lot of them were kind of quiet about that last year, not wanting to release those numbers right away.
Sure, I cannot speak to the conversations. I think a lot of those still need to be had. I mean, it's just a process that they're obviously, they're going to have a lot of calls. They're going to have a high volume here for the next week. So I think it's something that we figure out. I don't know what the frequency is, if it's monthly or weekly, but it's, there's also 5 different carriers, so they all have to be on board. If we get numbers from 3 and not from 2, we have an incomplete list. So.
Well, and probably if you don't have a buy-in from all of them, they'll all be a little resistant.
Absolutely.
Yeah.
And they have a lot on their plate as well.
Yeah.
Well, and if you recall, we're relying on them to tell us what our membership is for the PMPM. They owe us back those funds. So we will be setting up at a minimum the monthly reporting because they're going to have to submit those funds back to the exchange.
And I would ask, because we're all so excited about how this is going to work,
Sure.
And want to see it be as successful as possible, that we try and get the carriers to agree to something before our next December meeting so that we can get a feel for where we are, particularly, on the re-enrollment side of it. And I don't know if you can differentiate between that or not, between who's an old customer and who might be a new one. But
Madam Chair,
if there's some way, and I'm asking our executive director, Mr. Gilbert, that maybe that get on your very long to-do list.
Madam Chair, this is Laura Rich. I'm actually working with the carriers as we speak to develop a monthly report where they are going to be providing not only the PMPM reporting, but also statistics that are similar to what we've been reporting in the past. So we're going to try to, there's no promises. We're working with them. This is a process that we have just barely initiated, and the carriers have stated that they're willing to participate and they're willing to provide this information to us. So we are hoping to have a formal process by February, developed by February, but in the meantime, I have actually requested informal enrollment numbers, even if it's not, if they're not providing detailed enrollment statistics like we've been providing in the past, if we could at least have just a broad enrollment report, at least through this open enrollment period, and especially that first month.
Okay, yeah, and because our next meeting is December 11th, so if we could get something, everybody agree that they'll give numbers through, say, a week prior, December 4th, that would be wonderful if we could make that happen, because I know everybody's anxious to see how we're doing. I know you'll get a sense of it when you see the volume of people and how the stores are doing and how the fair is going to go at the Rio tomorrow. But we all want to see the numbers. So, anyway, Dr. Jameson.
I was just going back to now everyone's required to have an email address. Mm-hmm. And so what do they do if they don't have one?
We give them one.
Oh, that's it. You just give them one.
So we actually did some research on that.
Yeah.
There are, it takes quite a long time to do Google or Yahoo or some of those types of emails these days. You have to put in a lot of information. I know you just went through that.
Yeah.
Inbox.com is very, very fast. All you have to put in is your first and last name, and you can get an email address. When you create an account on healthcare.gov, so as a person is going through that pre-screener, we will ask them if they have an email address. If they don't, we'll create one for them. It's very quick. When they go to create their account on healthcare.gov, you have to put in that email address. You then have to go out to your email because they'll send a verification type of email. So as part of the process that the assistant or the broker will go through with that applicant is that process. Go click on the link in your email and then send you back in.
For those that don't have a computer, will they be able to come to the store and check? Will you have them available for the clients?
So if they come to the store, they would go through the process of.
No, I mean, they've got your email and maybe they want to do something through an email with their account, with whatever they talk to their. Once they get it, do they never have to follow up with anyone else?
As you fill out the application, similar to last year, it gives you the opportunity to say, I want electronic notifications or I want it via mail. So if there is someone who never wants to look at that email again, they don't have to.
Oh, okay, there we go. And then I was really curious because I know one of the beautiful benefits when you had a lot of people being navigators and enrollment assisters throughout the community was, and I visited some of them on their sites, whether they were like at Walmart, where they might be in a low-income neighborhood, and a lot of those people that were really good people that we would want to reach out to, where they could connect with them at the store, and so they were right there and available to them. So I'm wondering, you mentioned when you asked for people to volunteer to come and work at the store, and a lot of them are going to come at the store now. Do you have the numbers of how many people last time had little satellite operations scattered throughout the city? Like maybe there were 200 people that might have been stationed at a Walmart or a Lowe's or whatever, and now we're going to have 2 stores and 10 people out there?
No, I apologize. I don't have those numbers. I know a lot of brokers have those satellite offices at Walmarts, in malls, all over the place.
So
and I don't think that
is
out
there.
Yes, I don't think that our store is affecting that at all.
Okay, great.
And as a matter of fact, I know of several brokers who are doing both.
Okay,
Yes.
That's great because that's one of the key issues for these clientele is that they're really accessible. You know, that they can get to them with a walk or on an easy bus stop. You know, that they're really there. So I'm really glad to hear that.
And in addition, our EEF organizations, they're not just in the stores. They're all over the city, especially if you go look at the calendars. Boy, they are
Libraries.
They are all over the place. The libraries, the malls, the grocery stores. There's a huge amount of activity.
Do you actually have then, besides having the brokers, exchange people, having their names, etc., and you have the locations of where they set up?
I do for the EEFs because we have the links for the calendars and it tells them exactly when they're going to be there and what time. Now I don't for brokers, but for at least the 3 navigator organizations, we absolutely do have that out there on our site.
Is it possible to do the others?
To link to all the brokers?
Wouldn't want to. No advantage.
I don't know that I've even thought about that, or Tyler's thought about that, or anybody's thought about that yet. So it's something we can discuss.
Would it be any advantage?
I don't know.
Just talking about accessibility for every person.
All right. Do we have any other questions?
I have a question. I don't know if this is still relevant or not. It seems to me a week or 10 days ago, I heard about the federal government creating another website that you could just go in and browse. You weren't ready to buy, but you just wanted to see what was out there. Is that happening, and do we have a link to that on our Nevada Health link? I think Bruce has a
If I may answer that question, that's actually not a separate website. It is part of the healthcare.gov website, and it is sort of a take a look around shopping experience as opposed to going through the entirety of it. It is not as accurate in some aspects as I would like it to be. I think that there are areas in which you are far better served not utilizing that and going forward with the process, especially with a navigator, broker, or agent. But that functionality is in fact on the system even as we speak.
As I was remembering the story, I thought the point was to take some of the pressure off of healthcare.gov volume-wise for people that were just looking.
I think that that's true. I think it was meant to give people sort of, one of the complaints last year was there was no window into the system. And you really didn't know anything about available plans or eligibility or about potential tax credits until you actually went through the process. The preview portion of the website, which they brought up last week, you're correct about that, is an attempt to let people sort of do some window shopping, if you will, as opposed to going in and going through the entirety of the purchasing process. So it answered one of the complaints that was raised last year, and it also gave folks an opportunity, I think, to get a sense of the site's speed, what it looks like, how it sort of works.
Okay, thank you.
Yes.
Lynn Atkins for the record. So I just want to say it just sounds very exciting, and that it seems like we've tackled two really large obstacles we had last time, which I think obviously with the technology, and that sounds like that is going to be significantly smoother. But also really understanding that I think at the end of the day, we're a consumer-driven business, and we are here to try and make it easy for people to get health insurance. And I think adding the stores, I think really trying, getting more information on the website for people to have access to really use all of the partners in the way that we're using them, I think is wonderful. I think the excitement that I hear from everybody on staff is just, after some challenging times, I think is just great. And when I'm sure people walk into these events or walk into the stores and meet with anybody from staff, KPS3, navigators, brokers, I think they are going to have that kind of positive energy experience, and will, it won't be perfect, but there are going to be people there helping who are excited and positive and trying to make this work. And I think at the end of the day, that's the best we can do. And so I commend everybody for just really, really working so hard to just create what we anticipate is going to be a very successful open enrollment.
Like I said, you can really see the maturity level of us changing significantly, and that's wonderful. I'm on the site right now playing with it and asking for assistance and putting zip codes in. And it's amazing. It brings up the map and it shows you it. And when you touch it, it tells you the broker and what their hours are. I mean, it's really consumer friendly. So thank you all. Do we have any other items we want to cover under this agenda item? If not, let's move along to the monthly budget report. And do we have, is it Ms. Eaton that's doing that for us today?
Madam Chair, normally Ms. Eaton would. Ms. Eaton's not here this afternoon. Damon Haycock for the record. I'll go ahead and give this report. It's a very brief.
Okay, well,
it's just an overview of the budget and projections moving forward. Obviously, we are still a grant-funded agency. Initially, the grants were supposed to expire at the end of December. However, we requested no-cost extensions to take those grants into 2015. Those were authorized by CMS to be utilized for design, development, and implementation costs. We were able to carry forward 4 of our grants on these no-cost extensions. We're at the same time, we are also collecting per member per month fees for 2014 enrollees and have been since January. So we are able to build that reserve and to continue to pay for our navigators in our navigator program. On a state fiscal year basis, so far to date, we have spent approximately 55% of our budget, which is right on track for our budgeting purposes for the remainder of this fiscal year that ends on June 30th of next year. What you'll see on the chart on page 3, or the table on page 3, we've given a brief summary of what the agency request budget looked like that was submitted at the end of August. It was confidential per the rules up until October 15th, and now it is a public document. However, the budget building process utilizes a living document. As new information is realized and new opportunities are recognized, we have an opportunity to work back with our budget office and our Legislative Counsel Bureau analysts to help revise that budget accordingly. And we are currently doing that as we speak. The new version of that budget, once it becomes finalized, is known as the governor's recommended budget, and it remains confidential per statute until it's published on January 15th. So that's a very brief overview of the budget and where we're at today. If you have any questions, I'd be more than willing to answer.
Any questions on the budget? And again, this is forward planning. The budget would start July 1st, 2015 and go through June 30th, 2016.
That is
so
correct,
would you
Madam
please
Chair.
tell the feds we really need those numbers because that's how our budget is developed. All right. Any other questions or comments? But Dr. Jamison.
I just wondered, when they go ahead to 2017, and we may not have the answers to these questions, and they show the new budget versus 2016 projections, how it is that, like under contracts, it's an extra million, and how they would possibly know that and what those increased costs would be due to. When you talk about us trying to stay on a budget, why in 2017 they foresee a large increase there?
It's in the marketing.
Right. So Damon Haycock, for the record, that is one of those items that's being revised now. It'll be a more level number. We recognize that there's some shifting that needed to occur based on newer information, right? The board had made a decision that they wanted to approve for this year or this upcoming year a certain dollar amount for marketing. And so using that as a baseline, we wanted to continue to build budgets around those desired goals. Like I said, there are some shifting of these numbers that needs to still occur. And any increases or decreases must be justified to the hilt whenever we do anything to our base budget. And so through that budget building process, we have to submit notes and descriptions and spreadsheets and it could be any form of communication when it's all said and done that explains to not only our agency and our budget office and our Legislative Counsel Bureau, but something that we can defend when we sit up at the table at the legislature next session. So I see the hand up, so I'll turn it back over to Dr. Jamison.
Oh yeah, Dr. Jameson. I was just curious because I did remember, although I remember us passing it on the 2015 and us talking about, what was the 2015 marketing contract?
So the contractual amount that the board approved was to basically stay the course at $500,000 a month, which corresponded to a 4-month time frame or $2 million.
That just helps me look at these two numbers better.
Any other questions? All right, thank you, Mr. Haycock. All right, that brings us to item number 7, possible dates and times for agenda items and future meetings. Our next meeting is scheduled for Thursday, December 11th. And I know one of the items that we'd like to have on the agenda, if possible, are what are our numbers? Does anyone else have anything that they would like to request of staff to bring before the board? I think we'd ask for the normal reports that you have normally given us over the last several months, make sure that we fill in the gaps on that. And then Ms. Jamison?
Oh, I was just, I know what the numbers is what we're so excited about, and you did say when they leave the store that you'll pretty much have those numbers.
That's correct.
So that even we might be able to request, even though we might not get our total numbers, that maybe on any little subgroups, we could get numbers.
Absolutely.
Be great.
Yep.
This is also Johnson. I just have a question on getting the numbers. Given that we're using healthcare.gov, this time around, it's going to be anybody that enrolled. It's not going to be those that enrolled and paid, right? Okay. So we'd have to not try to do year-to-year comparisons as a result. Okay.
And that's where we would depend upon our carriers to give us information because they are doing the billing and the collection of the monies. So, and that'll be accurate. So, all right. That brings us to public comment. Do we have any public comment in Carson City?
There's none here, Madam Chair.
All right, any here in Henderson? All right, I think we'll get ready to close. 9 hours and counting. I think I see a very excited staff and an excited board. It'll be, and Mr. Gilbert, you have my cell phone number. I'd like to have an update through tomorrow.
I do indeed.
All righty. Thank you all. Exciting times, and we'll look forward to getting some at least initial reports over the weekend.
Thank you very much.
Sounds
All right.
great. Thank you, Tyler. Thank you, Sean.